Hello, and welcome to this lecture on research ethics, where we're going to take a look at Pernkopf's Atlas of Topographical and Applied Human Anatomy. Taking a look at kind of surgery and surgeons and the training of surgeons, what we can see is that throughout the history of time, both clinicians and scientists have often used the study of dissections of human cadavers in order to learn human anatomy. And so this is basically kind of an artist's painting by by Michael Johns van Mierevelt in 1617, looking at an anatomy lesson where, they basically have a cadaver there going through and trying to learn about some of the abdominal organs as they're going through. And this is pretty much continued throughout time to modern day. A little bit different today than in kind of 1600s is that many organizations, many institutions of training are moving away from human cadavers into the use of digitized specimens. And so we've got two examples of computer instruction for learning gross anatomy over here. We've got a computer program where you'll look at it on your tablet or look at it on your computer screen. You can click on things here and move, essentially move or remove kind of superficial or kind of overlying tissues or organs and see kind of what's down kind of underneath. More recently, they've got these dissection tables where, again, it's got a digitized cadaver, and then you can go through and instead of kind of manipulating a computer screen, manipulate this table and kind of expose organs, expose tissues in that way. However, both these computer programs and these digitized anatomy tables require, kind of previous dissection, require previous kind of collection of the data and understanding of the data in order to be able to program or build these techniques for training clinicians, for training individuals on how the human body is going to be working. Now, what we can see is that in our example we're going to be looking at, Dr. Susan McKinnon is an internationally renowned peripheral nerve surgeon. She's actually chair of plastic surgery at the Washington University School of Medicine in St. Louis. And she's a world-renowned expert on peripheral nerve transplants, kind of peripheral nerve treatment, surgeries associated with the peripheral nerve. So much so that she's an author of a premier nerve surgery, a textbook used in training clinicians. And she's been an author of over 500 articles and book chapters. So very knowledgeable, very successful. Examples of her awards that she's received, just a few that I pulled off the web. She was elected to the National Academy of Medicine within the National Academy of Sciences. She was National Physician of the Year, Clinician of the Year. She received an Innovation Award for some of the surgical advances that she made within nerve surgery, peripheral nerve surgery. So she is very well respected, very renowned, and very good at her job. Now, in 2014, Dr. McKinnon was performing what should have been kind of a normal surgery, but it became technically challenging. Basically, what she was looking at is, this is an image of the knee, which has been exposed through surgery. We've got the saphenous nerve, which is kind of coming through this region right here in the area of the knee. She was working with a patient that had had several knee replacements. And as a result of those knee replacement, there was impingement or kind of, in essence, pinching. I lost my mouse, pinching of the saphenous nerve as a result of those knee replacements. And by the pinching of the nerve, it was generating unbearable pain within her 50-year-old patient. And so what she was going to be doing within her surgery is going through, isolating the saphenous nerve and basically removing the scar tissue around it, removing those structures that were created by the knee replacement and were causing pinching, causing damage to the nerve, and causing pain within the patient. When she got into the surgical realm, again, basically trying to find the saphenous nerve, tracing the roots so that she can kind of work her way back through both the muscle and connective tissue, expose it and eliminate the kind of physical structures that were impeding the function of that. She found out that it was a lot more complicated than she had planned, and that it was very difficult to trace the path that this nerve was going. And so what she did was what a lot of surgeons would do under these circumstances, is she paused the surgery. She basically said, okay, I need to take a break. I need to figure out what's going on. And one of the things that surgeons do on these circumstances is they will start to consult an anatomical map. You know, you can't run down to the cadaver lab and start to dissect it out and figure out where it's going. You have to refer to kind of pre-existing resources that are available. And so she basically went, called a colleague and said, in my office, I have a book, find the picture, take a picture of it, send it to me. And they put that picture up on a computer screen within surgery so that she was able to continue it. And so this is something that often occurs with surgeons. They'll use anatomical atlases to plan for and prepare for kind of uncommon surgical procedures. If it's a surgery that you do, 4 surgeries every day of the same type over and over again throughout your entire surgical career, you probably don't have to refer to an atlas every single time. But if it's a surgery that you do once every 3 months or once a year or once in a lifetime, you're going to start to refer to these references to prepare yourself and plan for the surgery. And so the most common atlas that most medical schools use in the training of clinicians is Netter's atlas. But Dr. McKinnon received a copy of Pernkopf's anatomy. I'm going to use the shorter name because it's very, very long, but Pernkopf's anatomy in the early 1980s, when she was kind of finishing up with her training as a clinician, especially since she was going to be a surgeon. This was a premier surgical reference, premier anatomical reference that was available that she could reference. And the reason why it's a superior resource, again, Netter is the one that's most commonly used in medical schools. Pernkopf's is one often used by surgeons, is if we look at the level of detail. And in this case, we've got, and you don't have to worry about all the little names associated with it, but this is the comparable region in Netter's atlas and Pernkopf's atlas. And you can see that the level of detail and specificity and precision in Pernkopf's atlas is very, very different from Netter's. Netter's is good, Netter's is a great reference, but Pernkopf's potentially has a lot more information, especially for a surgeon that has to go through and understand the very precise, very fine details here. Because the idea of surgery is you don't want to cut anything that you can't see. But you need to be able to cut it and move stuff so that you can get into the tissue. So you really need to understand how everything is put together at a very precise detail as opposed to this broader detail with Netter's. And so if we take a look at this, Eduard Pernkopf was an Austrian professor of anatomy at the University of Vienna. He went to the University of Vienna in 1920 as a professor, became dean of the medical school in 1938, and rector, which is kind of roughly the president of the university from 1943 to 1945. During this period of time, over a period of over 20 years, he worked with a series of artists. So here's Pernkopf in the middle with artists kind of around him, the 4 artists that he worked with during the majority of this time to create Pernkopf's atlas of topographical and applied human anatomy. They went through and did lots of detailed dissections, and then the artist would take a look at the dissection, reproduce it in a drawing, which Pernkopf would then go through and label. And so it resulted in this very precise and very specific atlas, which was published for an extended period of time. However, in the 1980s, it was reported that Pernkopf was involved with the National Socialist Party in Austria. And the National Socialist Party was, in essence, the Nazis. And an investigation in the 1980s into Pernkopf and the history of this book, this monumental work, was able to determine that Pernkopf joined the Nazi Party's foreign organization because he was an Austrian. This was prior to the annexation of Austria by Nazi Germany. But he joined them in 1933. When Germany actually annexed Austria in 1938. This was during the period of time where Pernkopf was dean of the medical school. He fired all of the Jewish professors at the medical school at that time. And so he had evidence of very anti-Jewish leanings within his role within the medical school. And then over time, they studied the source of the diagrams, the drawings that were made for his atlas. And they were able to determine that, at least in part, some of the samples or some of the cadavers that he worked with were dissections of people that had been executed by the Nazis. And so, especially ethical troubling with that. And then as they, again, continued their investigations looking at it, they were able to determine that those artists that he'd been working with, the 4 artists on this previous slide, had often included swastikas and the double lightning bolt SS, which is the symbol, the swastika, in their signatures and kind of hidden them within the images. In more recent versions of the textbook, these were later airbrushed out, so it wasn't as obvious of the Nazi origin and Nazi influence on this work. But it became very, very apparent that Pernkopf had some serious ethical issues associated with his work, with his actions, and associated with this atlas that he created. In the aftermath of the investigations, the publisher of the book discontinued the book, and by 1994 had ceased reprinting it because of the concerns that, in essence, these were drawings of individuals that had been executed by the Nazis. Some libraries that have had access or had the book, had it in their holdings, began putting it in a restricted section and restricting access to it. However, even though it's no longer available to get new, there are still thousands of copies of this book in private collections, in the collections of surgeons kind of in the US and around the world, and you can also find them on the used book market. You can find copies of this. I looked on Amazon's resale set. You can buy used copies of it in good shape, fairly pricing, $600 to several $1,000 range, but they're more available. And there is the potential that it is needed because it is currently the most detailed anatomical atlas that is out there and is available. So the question then becomes, we've got this incredible resource that's available to us, but should we be using it? Should we use this resource that was created in very unethical ways to use it in surgery today? And so Dr. McKinnon and others in her surgical group reached out to a variety of clinicians and ethicists to really consider about whether or not it's appropriate to use Pernkopf's atlas in a surgical setting. And they published a peer review paper on this in the journal Surgery in 2019. And included with this, they interviewed and queried experts on Jewish ethics and law about whether or not it's appropriate to use this atlas given the highly, I don't even say questionable, the highly concerning, highly, I'm not even sure the word to use it, but tainted source of the information. And according to some of the experts they consulted, the highest principle in Jewish law is life. And the experts that they queried on this said basically, if using this textbook would save a life or alleviate suffering, it's permissible to use that information. It's permissible to use the atlas to plan a surgery if it's going to save a life or alleviate the suffering of the patient. But they went a step further and said, yeah, it's okay to use the information, but you really need to make an intentional thought about what are the origins, where did this come from, and pay respect to those that were killed to create it. And so pay respect to recognize the contributions, non-voluntary contributions of the individuals that were used as subjects for this textbook. So this is an example of using Nazi data, but there are other examples as well. Much of the Nazi data that came out from that period of time has been considered scientific unreliable. But some aspects of it continue to be used. Examples of that were hypothermia experiments, where they would basically take prisoners, immerse them in freezing cold water, and monitor them in order to be able to understand the effects of hypothermia. So if you had a pilot that goes down in the northern English Sea, or go down in the Atlantic, what types of things need to be done to try to prevent them from dying of hypothermia before they're rescued. They did phosphine gas experiments where they would expose prisoners to poisons to be able to better understand the effects of the poisons on the body and potentially how to treat it or how to kind of promote survival from it. They did tissue and organ damage. They would do penetrating wounds of a whole variety of very disturbing ways of doing it. Gunshot wounds, knife wounds, blood trauma, to study kind of the impact and the actions of those type of wounds within the body. And that's an example of one that's actually been used most recently. It was used by the United States to design flak jackets to, in essence, design body armor to protect the individuals, the soldiers that would be wearing it, from potential tissue or organ damage associated with it. So, even though, there are huge ethical issues associated with it, some aspects of it, some aspects of this Nazi data are being used in limited ways. Now, Arthur Kaplan is a professor of bioethics at New York University, and kind of in response to that surgery article that McKinnon and her group wrote, he wrote a commentary that went along with it. And he basically said that each use of compromised, tainted, or immorally acquired data and information based on such data, so basically the Nazi data or other examples of really questionable data on vulnerable subjects, potentially could be used. The use of it must be resolved on a case-by-case basis. And so basically Kaplan is saying that it's potentially available for use, but we need to not just go to that as the first choice, but consider, is there alternatives? What do any surviving subjects say about the use of that? Is there certainty that honor will not occur to those who are engaged in the evil? So you're not, recognizing the contributions of people that did really horrific things. And, is it, worth the risk? Is it worth, is there a likelihood that the benefit of using this data will be enhanced by using it over not using it at all? And so, again, very, very troubling, but again, potentially kind of opening it up to continually use Pernkopf's atlas. Some questions to consider within this lecture are, when is it permissible, if ever, to use data collected, tainted data collected in unethical ways? And as a follow-up to that, does it matter if use of the data will save a life? And does it matter if it will improve the quality of life of an individual or group of individuals? Will it be mildly beneficial to a small group of people? Or are we using it solely to advance the scientific understanding of a topic? A lot of questions associated with this. And sadly, it wasn't only Nazi Germany that did these types of questionable studies on vulnerable subjects. It occurred in Japan with prisoners of war. It's occurred in the United States with individuals within the criminal justice system, individuals in impoverished communities. So there are lots of examples, sadly, of tainted data that was collected in unethical ways. And we need to determine when, if ever, is it appropriate to use this data. Just an example of some of the references associated with this. And then again, some additional references related to the textbook and the Nuremberg kind of trials and the results after that. So thank you and have a great day.